healthcare workers across the country are struggling to keep up with rising cases. You just heard in Mayor of Albuquerque, they got a staffing issue there, among other things. Hospitalizations and deaths in their communities are just overwhelming too many folks. But in some places, these healthcare workers are struggling to fight misinformation about the virus. In Johnson City, Tennessee, non-emergency procedures have been postponed, and the area's largest medical center had to bring in a mobile morgue truck from FEMA to handle the increase in deaths. And then when news stories of the morgue truck hit the local airwaves, some residents of Johnson City took to social media to deny the morgue truck's existence, not making this up, suggesting somehow that the morgue was meant to spread fear or that the pictures were somehow faked. Well, joining me now from Johnson Medical Center is NBC News reporter Dasha Burns from Johnson City, Tennessee. So Dasha, it's one thing to fight the virus. It's another thing to fight misinformation about the virus here. What's been tougher for these healthcare workers?
Chuck, where I'm standing right now, this is not comfortable. These things are not comfortable or easy to talk about, but we're here because this is the grim reality. This morgue trailer behind me here, this is very real, as you can see, and it is very necessary because the fact is that right now, Johnson City Medical Center, their morgue is full as of today. And while this trailer is empty right now, it is possible, if not probable, that that will no longer be the case at some point today. And still, there are patients coming into this hospital sick with COVID who don't believe this virus is real. And that is perhaps, Chuck, the most heartbreaking thing for these frontline workers. I want you to hear from one of those nurses, Allison Johnson, and also from a former COVID patient whose husband recently died from the virus, Teresa Fleming. Take a listen to these ladies.
Sometimes it's a struggle, especially with a patient population and people in the community that don't necessarily believe that COVID is real. Just this week, we have an ICU patient who came in extremely hypoxic, so his oxygen level was very low. They're referring to it as happy hypoxia. So he was stable with a low oxygen level, and he was in complete disbelief that he had COVID or that he was as sick as he was.
Were you surprised that something as straightforward and heartbreaking as a mobile morgue trailer is being questioned?
I've had a very difficult time wrapping my mind around the disbelief and the misinformation that exists in our community. So it's very sad when people call you a liar or say you're embellishing the truth, because I became a nurse to make a difference.
It's a real thing, and I want people to take it seriously. I don't want them to end up like me. I lost the love of my life. My grandsons that live with me, my daughter, they've lost their male role model, and we're all devastated, and we just miss him so much. He was a wonderful person.
Chuck, these stories are so hard to hear, and that patient that the nurse was talking about, he is now on a ventilator. He now believes in the reality, but misinformation can do such harm. There are people who are delaying care, who are not coming to the hospital because they don't believe they're sick, and by the time they get here, Chuck, it's too late.
Dasha Burns with some a reality check in Johnson City, Tennessee for us. Dasha, thank you, and please stay safe.